everyone, welcome to Frontlines of Future Care. I'm Smira Chutta, and today I have the pleasure of being joined by Dr. Andrew Lundquist. He's Chief Medical Officer at Mankato Clinic and works with AI tools with Nabla. We are so excited to have you on, Andrew. Thank you so much for being here.
It's a pleasure.
All right, so today we're going to dive into all of his work with AI and technology and how that kind of connects to healthcare. So, I think it's really cool how you're involved in both sides. You know, you're practicing in the clinic, but you're also managing on how to help move healthcare forward when you're bringing in AI and all of that. So I'm curious how you're using AI in your day-to-day life.
Well, it's a good first question because I think we'd be foolish to not embrace some of the advances that AI is allowing us, especially in healthcare. Now, healthcare, we're dealing with people's health and people's lives, and so we need to be careful with what we're doing, but we can't ignore some of the things that AI allows us to do. So, very simply for my organization, Mankato Clinic, and then for the company that I also get to work with, Nabla, is we bring a documentation tool to our clinicians that allows them to just sit there and have a conversation with their patient instead of sitting there talking to the patient but having your nose in your computer.
Yes.
And and so that's the tool that we've really used in our clinic to help to give us that efficiency. And so the things that we're finding is that we're finding that our patient interactions are a lot more deep because we're able to think about the things that are happening within the room as opposed to thinking, hey, I need to document this. It's a
Right.
very different thought process. So we think about clinician mental burden
Mm-hmm.
as really the kind of the first thing that we're addressing. And it's really exciting what we're seeing.
Yeah, that's really nice because I think it's important. A lot of times when people are, talking with doctors, it's good to have like one-on-one patient care, and it's a lot more focused on the patients while, taking care of that mentality for the clinicians as well. So I think that's really exciting what you're doing there. Is there any time when you bring in these new tools that you think that the hospitals or the clinicians don't account for, like they forget something or, they just miss out on an aspect and it kind of causes a problem.
Yeah, so the workflow is the thing that we talk about often. So that's just the way that work gets done within healthcare. And if you mess with that with the clinician,
Hmm.
you're probably going to have problems. So the way that clinicians are trained is they have a way that they go through seeing a patient, everything from how they think about that patient to begin with, how they enter data in the chart, where they go to look up information on that patient, where they send the patient, how their nurse works, how their staff works afterwards. So you have to take that whole patient flow, that patient workflow into account
Right.
because you may have a wonderful idea that solves a certain problem,
Yeah.
but if it causes problems on the front end and the back end,
Hmm.
clinicians are never going to do it.
Yeah.
They're never going to use it. And clinicians are really good at silently quitting, meaning you may give them a wonderful tool, tell them all about it, train them how to use it, but if it causes them like an extra couple of minutes on the front end or back end,
Uh-huh.
they'll just never use it. And they'll just go back to the way that they were trained.
Yeah.
So that's kind of the barrier of entry we have for any tool.
Yeah. No, I think that's important to consider that. Um, when you're bringing in these new AI tools, do you think, AI is obviously moving everything forward and we all like the benefits of AI, but I know you're so involved in this. I mean, I have to ask, is there any downside or problem that you see with AI causes any harm one way or another?
So I like to talk about AI as a lot like any other tool.
Hmm.
And it's not like any other tool. It has its own, pluses and minuses. But one of the analogies that I like to use, and I put this on LinkedIn often, is that, things look scary in healthcare. I put a picture up of a bunch of scalpels,
Hmm.
right? Those are knives that we use to cut people open.
Yeah.
Um, and so that's in the wrong hands, that's a really bad thing. But we train people how to use them. We train them how to use them properly. So same thing with AI. Like anything that you have to use in healthcare, there's a risk, and you have to make sure that you're controlling that risk. you're using for the thing that it is created for. And then there may be problems that come because of what you're using, and you have to make sure that those are minimized and then mitigated. And things happen in healthcare. We
Yeah.
deal with risk all the time. To do something is risk, to not do something is risk, and so we're okay dealing in that environment as long as we understand the tool that we're using.
Yeah. I think that's a really interesting perspective. I mean, a lot of people, I feel like, argue that AI is out of your control, but when you put it that way, it's like, no, it's fully in your control. You just have to be taught how to properly use it. It's just like any other tool. So, yeah.
Yeah,
Um,
yeah.
so do you have any trouble when trying to get patients to trust AI? Or, patients and doctors really, but I think that a lot of people may be like, okay, I'm not gonna trust this. Like I don't, it's not a person doing this. Do you have any problems with that, or how do you mitigate those challenges?
We have had those problems, but I'll say that it's very minimal now.
Okay.
When we first started using an AI tool within the patient visit, we had to kind of train our clinicians and train our patients. And back then, and I say back then, it was only about 2 years ago,
Mhm.
AI had a very different mindset around it. People were more scared of it. It was more thought of as like a big brother, what's listening in on me. But people then ChatGPT came out and people use it all the time. Like I use it to look up research articles. I have to check them, of course, on the output, but I use it to do a lot of things, as does most people. So
Yeah,
it's no longer that people are scared of it. They've used it, they've looked at it, they know, they've heard of the phrase hallucination. They kind of know what's going on. So I'd say patients are sometimes skeptical, but
it's gone better.
mostly they're not. They're happy to just sit there and have a conversation with their doctor.
Yeah, no, I can definitely see that. I think times have definitely changed with the amount of people that are using AI all the time. Like we train people to use AI and use it in the right way, just like we train people to use instruments in the right way for,
Mhm.
practice. And for anyone who's not in the actually in the patient care room, do you have any advice for people who want to kind of help move healthcare forward, but are not actually practicing doctors? I just want to hear your opinion on, what you think people can do to help move AI forward and healthcare forward.
So I talk to a lot of people, a lot of founders, a lot of people working within healthcare that are not clinicians. And I think that we need to have everyone who's interested working on the solutions. We need to have the different frames of mind. And so, when we have people who have worked at other industries and they bring some ideas into healthcare, those could be really important. That perspective could be really important. Of course, you have to have a clinical lens to kind of filter those ideas through, but some of the advances that we've seen have come from people who've worked in other industries. And I would say that kind of multifactorial or that way of looking at things it's important. So
Yeah.
some of the efficiencies we see in healthcare, um, there are efficiencies, but there's a lot of inefficiencies, and looking at those things in a different way can be helpful.
Yeah, definitely. Thank
So
you for
I would say to those people who are, thinking about coming into healthcare and they feel like they don't have a lot of experience,
Mhm.
uh, try to find a clinician who you can talk to about whatever solution you're thinking of.
Mhm.
Um, Try to vet that out. But there's a lot of really good people who aren't clinically trained doing good things in healthcare.
Yeah, definitely. Thank you for that. Okay, I have a fun question to wrap up. What would you say is your favorite healthcare resource, for innovators? It could be like a book, an article, website, anything like that. Do you have one?
Yeah, I have two of them.
Okay.
First off, I like LinkedIn. I mean, that's how we got connected.
Yes, definitely.
I'm on it. I'm on it every day, and I use that to kind of keep up on what's happening. And there are a number of people that I follow in there that are putting out things that are really, really important. I do think that there's the Health Tech Nerds
Mm-hmm.
community,
Mm-hmm.
and you can sign up for that for free. And it's a group of people within health tech looking at things, and there's a newsletter you can sign up for. I think Christina Farr,
Mm-hmm.
she puts out Second Opinion newsletter. I think she has a really good eye on what's happening within health tech with a very unique lens from looking at it from an investor and a journalist. So
Mm-hmm.
those are those are a few of the ones that I keep an eye on.
Yes, I'll be adding those to my list here. Okay,
Yeah,
thank you so much for your time and for sharing all of this. I know that everyone listening is going to take a lot away from this conversation, so thank you so much.
you're welcome. Thanks for having me.